Well, let me first introduce Dr. Rob Kairam. I know him from Bronx Lebanon Hospital, and he started this Autism Treatment and Advocacy Center. And I'm going to keep talking while Ram is getting himself together there. But the one thing that always impressed me the most since day one is that you've always emphasized parent training. When I give talks and I talk about parent training, I told you this, I put your face on, I put your name on. I feel that you are one of the leaders in the field for parent training. I don't see anybody else compared to what you've been doing for 40 years. You've diagnosed over 4,000 kids, and you devoted your life's work to this, and now you left Bronx, Lebanon, and now you're in Texas, involved with so many things, and you can certainly talk about what you're involved in. But I just want to introduce you as a pediatric neurologist and certainly one of the leaders in the field. So I thank you for joining Autism Today and the conference. So the first question that came to my mind is that when you've seen thousands of these kids on the autism spectrum. Is there an issue or a problem that you've seen most often? Like what comes your way?
For the most part, I get involved when I have a family in front of me in my office, and the main reason they are there because the child is not speaking adequately for his age. And they have been pointing it out to the pediatrician. The pediatrician says, let's wait and see. Not all children begin to talk at the same time. So-and-so also spoke late and he went to college subsequently, etc., etc. By the time the mother goes back to the same doctor the second time or the third time, this time he says this is a speech disorder, a speech delay, or a speech apraxia. The speech is there, but it's not clear. And he is not articulating words well. So speech delay, speech disorder, speech apraxia all have ICD codes.
Right.
So you put an ICD code and send to early childhood intervention. Early childhood intervention is extremely well-funded program giving intervention to children from birth to age 3. But unfortunately, many early childhood programs do not demand a diagnosis. They are taking the ICD code, speech delay, speech disorder, but they're not asking due to what. So I used my opportunity to explain to parents, speech disorder is not a disorder of the gastrointestinal tract or the renal system, the kidney. It's a brain disorder. We're obligated to make a diagnosis. Sometimes the diagnosis could be serious. Intellectual disability, old name, mental retardation. You need to know that. So I endeavor to give the family a diagnosis for this so-called speech disorder. That is how I have seen nearly 80% of the children in the last many, many years.
Yeah, I'm going to jump in, and I've experienced the same kind of thing where it's diagnosing it as a speech disorder. The way I look at it, it's easy. It's an easy diagnosis, as you say. It's part of the code. Insurance pays for it. It fits into the medical system, and like if it's a cognitive impairment or something, like what do we do with that? But speech is part of the system. It's easy. It's clear, it's obvious, you see it, and that's good enough. Unfortunately, it's good enough for the system and for the parents and for the kids. And like you were saying, sometimes by the time they find out that if it weren't for you looking at the kid, it may take them years to find out that, hey, this child is really on the autism spectrum, and that's a disservice.
So the other important thing is sometimes I get upset because the grandmother is helping to watch the child. Sometimes she's babysitting, and she says to the mother of the child, honey, our child is already 2.5. He's not talking. Go take him to see the doctor. And the doctor says, speech delay. Sir, she already said it's speech delay. So I get involved in trying to get a diagnosis. And that is where the key here is getting an early diagnosis and finding out whether it is autism, because everybody in the world now knows the most important thing in autism spectrum is early diagnosis and early introduction of behavior therapy. So, if I may say so, the bulk of what I do is attempting to make early diagnosis of autism and get rid of the words like speech apraxia, speech delay, sensory issues. My child has many sensory issues. He doesn't sleep through the night, blah, blah, blah. They're all symptoms. What's the diagnosis? So that is basically a summary of what I do in the initial visit in my office.
So I don't want to get both of us in trouble, but the logic of speech delay means the treatment is a speech therapist, and people go down that route. And I mean, I feel one way, but I want you to, if you have any comments on that, that you're saying, stop, stop this, this line of thinking. And now once you get the diagnosis of autism, it changes everything.
But you are asking a very important question. And in research and in epidemiology, we must be very careful about this sample. Let's say there is a child who has speech delay and he went to a speech therapist and the speech therapy benefited him. He started talking, but is also behaving well. There are no other issues. And you go to daycare center and go to school. I would never hear about him. I'm hearing about those children. You've already attended speech therapy for 1.5 years, 2 years. The kid is already 4 years old. That is where my frustration is. Madam, what did you think this was from? This is a brain disorder. We are obligated to make a diagnosis on this child. God forbid, if I end up making a diagnosis of mental retardation, that's a serious problem. But if it is autism, I would regret I had not made the diagnosis 18 months ago. So
Right.
this has been my shouting from the rooftops in my so-called parent education classes. And sometimes the medical reimbursement system gives a physician like me only 25 minutes or 30 minutes. So I cannot do a lot in 25 minutes. So I run a class. I gather up my parents and I talk sometimes until the cows come home. There are so many times, you would not believe me, I can talk for 2.5 hours. My mouth actually hurts.
I've been there.
So I truly believe parent education, parent advocacy, teaching the mother how to go and get a diagnosis, how to navigate the school board, and how to understand the IDEA, free and appropriate public education, leading to an IEP, a disability determination. What is the diagnosis, and does the remedial mechanism reflect the child's medical condition? This is what I'm doing every day nowadays.
You're saying something very interesting. If I'm hearing you right, we are trained. We as a society, we're trained. We go to a doctor, they tell us what to do, we listen, and that's it. And you're saying, wait a second, if you want your child, and the doc may say, no, there's a speech delay, and you're saying, wait, it really is up to the parent to think and question and navigate the system and get maybe other opinions and to try to put things together that it may not go beyond just speech. And you're not saying I'm against these docs who are saying speech. You're really putting the burden on the parent.
I am, because the parent at a minimum, I hope, has learned normal developmental milestones. I cannot be hard on a child who's not fully toilet trained at 18 months. But I must know that if the child is not toilet trained at 4, there is a problem. Like that, if I understood normal developmental milestones, a mother would be able to say, this child's speech is delayed. So here is something interesting. I always ask such a person, have you ever met a deaf mute? They look at me surprised. So do you know what is a deaf mute? Yeah, I think it is somebody who cannot talk. Well, somebody who cannot talk because he's deaf from birth. He never acquired speech. But, miss, such a person can go to college. This is not a speech problem. This is a behavior disorder. It's well known. Therefore, we have to go beyond speech and teach the child how to communicate, how to acquire language. Language is much bigger than speech. I learned that from a man called Autism Speech in New York State.
Thank you. Anything that I've contributed to you is 10 times fold you helping me.
Not many people name their company Autism Speech.
So, well, that really says a lot. I think it's going to help many, even with parents of older kids who got stuck in the system. There could be kids 6, 7, 8 years old. I mean, it's not too late to say, wait a second, let's look into this in a different way. And instead of coping to the little things, trying to get by, maybe there's some underlying autistic nature there that really has to be looked at. So I think this really, really helps a lot. I mean, I have, when you're thinking about diagnosis, one of your jobs is to, where does autism end and where does a psychiatric, diagnosis begin? And how do you, like, you made a great distinction. If the speech therapist, works after 3 months or whatever, and the kid's, good, you'll never see the kid.
Correct.
And I know when you have a wonderful slide that something I learned from you. It's a slide of, and I actually have copies of this. Autism's in the middle, and there are literally 30 spokes that autism is part of. It's not just speech; it's anxiety, depression. It's all kinds of factors that could comorbidity, if you want to call it that. So how do you make that distinction between autism and other diagnoses?
Well, I actually titled those 2 slides, Comorbidities of Autism. In the upper left-hand corner are speech disorder, speech delay, speech apraxia, expressive language disorder, developmental language disorder. Everything else is okay. Only speech has not come and it is still developing. The kid is sweet, doesn't have any objectionable behaviors. There are no repetitive behaviors. So I might call it developmental language disorder. The mother is looking at me perplexed. I tell her, have you ever heard of developmental urination disorder? Developmental defecation disorder? This is a child who still has not conquered pee-pee and poo-poo. But everything is good. And the younger child is already going to daycare and he wants to go. And the mother says, no, your baby brother is in toilet train. I'm going to put you on the toilet seat. If you can do it, I'll send you. Within a couple of weeks, he's toilet trained. So there's nothing wrong with this guy. We call them developmental disorders. And then, popular word, my child has many sensory issues.
Right.
It's very sensory. He has a lot of issues with texture, certain foods, and noise, cloth, fabric. And my child has a lot of problems with food. He's very picky. If you let him, he will survive entirely on pizza. And auditory integration disorder. He goes very agitated and disturbed when I turn on the vacuum cleaner or buzzer or blender. Siren outside the window drives him crazy. My child has many issues with noise. Or I am having serious problem with toilet training. He's holding his caca. He just won't go. And every 7 days, 10 days, he has an explosive, foul-smelling stool. I explained to the parent, look, the guy is overweight. He eats very well. There's nothing wrong with his gut. It is a psychological constipation. It's a habitual constipation. He's holding it back. And he's afraid of going into his room. He wants to sleep with his mother all the time. You cannot separate him. There is a serious problem with anxiety in autism. That anxiety haunts you from age 18 months and toilet training until age 12 and the first middle school dance. Anxiety is a serious associated morbidity with autism. And as the child is getting older, we begin to realize he's not doing well academically, he might have some learning issues, and then comes the big beast, ADD, ADHD, very common. Unfortunately, many children are picked up for their ADD and not pick up the autism. And now the ICD diagnosis authorities have said you could have a child with two diagnoses, autism and ADHD. Even I, many years ago, used to argue, no, his ADHD is part of his autism. But now I'm putting both diagnoses because that allows me to educate parent regarding the ADHD part.
Yeah, yeah.
Then there is other issues.
You call it, by the way, or ADHD, AU, ADHD, or do you have a term for that?
No, I am using both diagnoses, autism and ADHD.
Right, okay, yeah.
So where I was going next with that is sometimes such a child, when you physically examine him, he's hypotonic, low tone. He looks a little too soft. So children with developmental delay also might have mild hypotonia. Hypotonia is a sign. Developmental delay is a symptom. But what's the diagnosis? The diagnosis could be something serious, such as cerebral palsy.
Oh,
So my obligation is to explain to the parent, this does not look like cerebral palsy. He's hypotonic, but he can walk across the room. He has enough strength. He does not have any of the neurological signs of brain injury. And then you have another problem, epilepsy. Seizures are more common in children with autism.
wow.
1 in 100 children have seizure disorder. 1 in 10 children might have a symptom, an event that looks like a seizure. So in autism, it's common to have EEG abnormalities. If the pediatrician had not thought through autism and he heard of a seizure-like symptom, he gets an EEG. If the EEG is abnormal, it's called epileptic. But seizures in autism are not as bad as seizures in general.
Wow.
So we are now still in that big circle that you mentioned with the spokes. Sticking out of the spokes is elective mutism, selective mutism. He is mute, will not open his mouth outside, only talks to grandmother, mother, and one teacher. That's it. What is this? It is basically related to the anxiety, which is a very integral part of his autism. So most of these things I described in the more recent sentences have to do with school. So you already have ADHD. He doesn't quite understand the other kids. He's not very social. He's also a bit hyperactive. He may be called a disruptive disorder.
Right.
And then he doesn't use the bathroom. He only wants to use the bathroom at home. He just can't deal with the toilet if it is not clean. So he holds on to his pee and caca. He has to get home in a hurry, go straight to the bathroom, and then he's smelling up the place. And his friends do not want to invite him to their house for a party. Nobody invites him. So such children have very difficult time with inadequate acquisition of age-appropriate social skills. And they don't know how to play, they don't know how to introduce themselves, they don't know how to cut into a play group, and they don't know how to learn to say, hi, my name is Jack, can I play with you? They just don't have it. They just break into the play. Now, some of these children, as they get older, develop obsessions, some obsessive compulsive behaviors.
Right.
They may or may not be called OCD, but there is a significant component of compulsive behaviors. And then comes a big problem, mood, anxious mood, depressed mood, and cycling. Sometimes the mood is very bad, and very often I have seen the older child with autism being diagnosed already as bipolar disorder.
Wow.
As you know, more and more children are being diagnosed with bipolar disorder nowadays, last 10, 12 years. Before that, we rarely made a diagnosis of bipolar disorder in children. So where I'm going now is there are so many psychiatric morbidities that reside within the autism. And at that point, I must tell you, because you are giving me that opportunity, people use the word autism spectrum loosely. At one time, what was called the autism spectrum had 5 conditions: autism, pervasive developmental disorder, Asperger disorder, childhood disintegrative disorder, and Rett disorder.
Right.
Rett gene has been found. Childhood disintegrated disorder is removed from here. The other 3 together have been lumped into autism. Autism is now high functioning autism or low functioning autism, determined by intellectual abilities. But still, people are walking around saying, oh, he's on the spectrum.
Hmm.
I don't-
And no Asperger's. The term Asperger's have been
Well,
omitted.
we are discouraging use of that word. The correct term is still autism, high functioning,
Hmm.
or to be correct, one should say higher functioning autism than the lower functioning autism.
By the way, me and people like me still use the term Asperger's, so I'm
Yes.
just letting the public know that it's still being used. But medically speaking, as of 2013, the word Asperger's is no longer used by the medical profession.
Sometimes it's difficult to get this back into the community. The Academy of Pediatrics put out interesting information. When the doctors change terminology or make recommendation, it takes on the average 17 years before people catch up. It happened with cough medicine and cough and cold medicine.
Well, I guess I'm a slow learner. It's only been 11 or 12 years, so I still have 5 more years. Yeah.
Asperger actually is a bit more accepted because people automatically assume you can read and you can talk and you have reasonable intellect and you went to school.
Right.
Autism still has serious problem with stigma associated with it.
Yeah, and a lot of people who are so-called Asperger, they prefer that, or sometimes they don't prefer. They want to be called autistic. They're proud of the autism,
But in that regard, I am fond of telling a story of a hypothetical parent that does not exist. And she is very frustrated because her boy, 12-year-old, is having serious problems in school. Other children don't seem to understand it. But he has high IQ. He plays piano. He's good at math. Every morning when she comes down the steps, getting ready to take him to school, this young fellow is all ready. He's all dressed. He wears the same kind of clothes all the time. He wears his pants up all the way to his chest. He puts on the top button of his shirt. And he's sitting there. She's coming down the steps. He's playing Mozart. He has no paper. He's not looking at sheet music. He's talented. He's 1 grade ahead in math. Really? You want to call my child autistic as though it's a disease? And your son is 2 grades behind in math. He's a jerk. He constantly gets sent to the principal's office. He's a bully. And you want to call your child normal? Madam, can you explain to me the word normal versus autism? So that is why we are beginning to use the word neurotypical versus atypical. So that way you don't use the word normal, abnormal. And the lady says, how dare you call my child abnormal? So there is a lot of issue with public education. As you know, 30 years ago, they named Autism April month as Autism Awareness Month. If you and I have any power, we should remove that. Who's not aware of autism? It should be Autism Acceptance Month, Autism Education Month, Autism Employment Month. We should work with autism, help families with autism, and the higher functioning autistic child should be programmed for employment because unemployment rate in autism is extraordinarily high. Interestingly, higher functioning autistic children, people, are good employees. They don't cheat, they do not manipulate their timesheet, they do their work.
Right.
And if you give them some rote work, they are very good at it. So we should recognize, celebrate, and get them employed.
Well, you bring up, I know I'm interrupting, but you brought up one thing that comes to my mind is that I know we started actually going into schools and helping or training the staff in terms of bullying. We had that experience together. So my question is, these kids are in school for whatever, 6 hours a day. Is there any, and now we talk about training parents, and let's say the parents got it. And now, and I don't have an answer to this, so I'm asking you. I mean, is there anything that a parent who's educated, been to your seminars and so forth, now the parent has to deal with the school who might not quite get it? And how is that dynamic? Do they bring in somebody like you? Will the staff listen to a parent? Do they have meetings? Do they talk to a teacher one-on-one? Do they have the kid involved? What comes to your mind between the parents, the kid, and the schools?
I have one extraordinary good experience in the Bronx, which I built upon, and I did it a couple more times. This was a 10-year-old, 2 grades ahead in math, but he looked like Tweedledee. You remember Tweedledee and Tweedledum?
Yeah.
He was like a ball. The guys would sit, one guy would bend behind him, another guy would throw him, and when he fell and rolled like a ball, and they would laugh.
See, this story you're not making up.
No, it's real.
I know.
Mother was devastated. She came to 2 of my classes and, sir, look what is going on. He's saying he doesn't want to go to school.
Right.
You'll be surprised to hear what happened. This was at the corner of Grand Concourse and Fordham Road, nearby a school. I went to the school. I went to the school principal, introduced myself, and I told him, can you allow me to talk to the parents of the other 18 kids? Guess what? She let me. The following Friday, the first period was delayed. All 18 parents were waiting for me in the conference room.
Wow.
I stood in front and I told them, look, this boy is intelligent. He has a high IQ. He's very strong in math. Someday he might give your boy a job, but look how they are treating him. You talk to your boys. You talk to your children. Be nice. Be kind. Don't do this to him because this affects him very badly. He feels very bad to come to school. Rob, you won't believe. It worked. The mother told me 2 months later, sir, it's a night and day. You know why? It's the parents. The parents understood their little angels that are going to school at 8 are actually torturing this kid. It works. We have to work with the other parents because autistic children have a lot of problems with social acceptance, playing,
Right.
being included in the cliques.
Wow.
So we have to talk to teachers.
I don't know many doctors who would do that. First, you need to know what to do. You need to know what to do. And then you actually went and did that. And what's remarkable in the arc of things, you changed everything around in one, whatever it was, a couple of hours.
Yes.
One day, that the idea of education could be very powerful if done in the right way. And it's really a message for really everybody.
In my class, I speak to parents about sleep. The child is 2.5.
In your parent training class.
Training class. Autism, 2.5, almost 3-year-old, doesn't sleep. He's still in the living room and she has to put him to bed. He cries his brains out. You know what I do now? Remove anything from that room that he can break. Put him in the room exactly at 8:55 every night. Lock the door. Let him cry. Madam, no child ever became ill from crying at night. Nobody. He will cry for 2 hours the first night. Don't open the door. At the end of 2 hours, you gently open the door. He's on the floor sleeping. Pick him up gently, put him in his bed. Don't bring him in your bed. The next night, 8:55 p.m., same thing. He will cry for 1 hour. Don't open the door. At the end of 1 hour, you open the door, he's on the floor sleeping. Next night, 10 minutes. Next night, 2 minutes, he's out. You can train children to sleep. Nobody does that. And the guy is up in his room, walking around. And I am now in Texas, in a relatively poor population. I have so many homes with 5 television sets. There's a television set in the kids' room. How you're going to modify sleep habits if there is a television in the room? So parent education is key.
And quoting you, you started a talk saying, has anyone ever heard of sleep therapy? And like, I don't know, I've never heard that before, but it was a wonderful way of starting a talk, sleep therapy.
I don't quite use the word sleep therapy, but I am a great believer that in developmentally aberrant children who either have ADHD, autism, difficult behaviors during the day, if you want the kid to go to school tomorrow and spend all day in school, he must sleep at night. And short of hitting him on his head, you must be strict about sleep time, sleep hours, and the room. No light. You know how many mothers are afraid to shut off the light? What are you afraid of? I told you to remove everything that he could hurt himself with.
Yeah.
At the most, he'll slide down the bed, come to the door, bang on the door, don't open it. But I have had wonderful experiences where a mother would tell me in one of my big classes, and she stands up and says, ladies, listen to what he's saying. I did exactly the same thing with my guy. He sleeps every night, all night.
Mm-hmm.
And sleep is key. And sleep is a serious, serious problem in autism.
When you have these groups, and I know you've been doing this for decades, and I was fortunate enough to be part of that, are parents, I think you may have just answered the question, do parents play a large role in helping each other, or it's mainly, please listen to some of the basic information that I'm giving you, and you are one of the best people I know in repeating the same thing over and over until people get it. So is it really kind of a, hey, you need to grasp the basics here. And our parents at the same time, helping each other at all, or maybe even giving you, information that, information that you're learning from?
Not much. I have been for almost 25 years a salaried doctor who accepted Medicaid in my clinics. So 90 or 85% of my population is low income, less sophisticated, undereducated. This is not the population where they connect with each other and they don't say, honey, call me, I'll tell you how to deal with it. It's not happening.
Yeah.
However, in the class, sometimes I have a lady who stands up and says, oh, he told me this a year ago. This is what I did. And I am now able to feed him at the table. You know what my solution is? He sit at the table, he give him a plate full of food. He doesn't eat, throw it out while he's watching. Honey, I gave you 25 minutes to finish that plate. You're still playing with it. Enough, we are done. In front of him, put the food in the garbage can. 5 hours later, at the next meal, the son of a gun is hungry. He will eat what you give. But if you walk around feeding him another morsel, you will never learn. So these are things that I have done that are protective. So I don't have a lot of parents that are calling each other in the evening and saying, this is what I did, please learn from me. I don't have that kind of population.
And I find, and people need to know that, because you, by choice, obviously, you spent your life in the South Bronx, where you worked, is arguably, I know where I actually worked in the Morrisania section. Per capita, that was the lowest per capita area in the entire country. So you put yourself in these situations, or well, that's the Bronx, or in New York City on 130th Street. It's the same, kind of thing, where they're just they're really the poorest people in in New York, in the country, and you thrive on that.
In fact, it has worked out well for me. And I think it's not that easy for other child neurologists or child psychiatrists to do this as a fee generating business, because the number of minutes that are needed do not produce enough income. But I've been fortunate. I was department head, department chairman. I had a salary. I was able to create and construct these programs with my department, my hospital, and sometimes outside money. So when I created the Child Studies Center in the year 2000, it was because of a large grant that was obtained for the Bronx through Congressman Jose Serrano Jr., $1 million.
Ooh, somebody had to write that grant.
Well, actually, these are what are called congressional pork barrel projects.
Good.
It was the largest of the ranking member of the Congressional Appropriations Committee. He was very kind to our hospital.
Hmm.
That is how I developed the Child Study Center. And that allows me to tell you something really important. That is, there is stigma in the lower income, especially Hispanic populations, of going to the mental health clinic, being seen coming out of a mental health clinic. So when I tried to do it through pediatrics, it was difficult. I didn't get paid. We did not get paid. So I changed the name. I called it Child Study Center. If your child is having problems in school, is not studying, is not progressing, he got suspended, he got sent to the principal's office, bring him to me. It's the same kid who did not come to the psychiatric clinic came to my child study center. So I had one of the earliest child study center for poor people, for
Wow.
Medicaid population. Now, as you know very well, the pinnacle of the child study center is Yale Child Study Center in New Rochelle. New Haven. And there is a child study center at NYU. Not many Medicaid patients, but mine was a Medicaid patient child study center. I did the same thing: diagnosis, parent education, advocacy, sending pieces of paper to the school district so the child can get what he needs.
Wow. I mean, that if this were in an auditorium, you'd be getting a round of applause. You realize that?
Well, it's your job to circulate what I'm saying then.
It's wonderful, and it's a model for other physicians, other people who are in a position to do the same thing.
But there is a bigger problem. You know, the diagnosis is controlled by DSM.
Right.
DSM is psychiatry.
Yeah.
Psychiatrists generally do not see children below the age of 5. And nowadays, it's very hard to get a child psychiatrist.
That's right.
Many of them don't accept insurance.
Hmm.
So how do you take care of 4-year-olds
Right.
with a condition that is controlled by psychiatry when they don't see the 4-year-olds? So I think basically they're orphaned.
Yeah. Right. Wow. That's a sad statement. Yeah. Well, somebody had been, one of my colleagues, Marcia Eckerd, Dr. Marcia Eckerd, she's interviewing for this conference a Ruth Fidler, who you probably I can't show you this book because of
I understand. Ruth what?
Ruth Fidler, and she's one of the experts on PDA, which is pathological demand avoidance, and this is becoming kind of a popular kind of thing. And I don't know if you ran through this at all, or this came across your desk, but I have one kid who I'm dealing with who's just avoids just ordinary demands, and the parents literally had to pick him up and drag him to his new school because they didn't want to change. And they have very smart. Usually they figure out ways of avoiding situations, and now there's a term for it: pathological demand avoidance, that they avoid anything that they're being asked to do. And so there needs to be a way of a workaround, like here are the options, and it's I don't know, it's just something that I'm looking at now, and it's becoming a thing. So I could tell by your body language you haven't really...
I have not actually used that term, but I've dealt with such children who are by this time 13, 15, 17. They
Right.
never leave home.
Right.
They demand the parent provide Wi-Fi so they can play video games online. And some of those guys are heavily involved with Roblox and what's the other one? The popular one.
Minecraft.
Minecraft. And then they don't even shower sometimes.
Right.
And they do not want to go out. They don't socialize.
And they don't like to commit to anything.
But there's a bigger problem. They don't even know where their dinner is coming from. What is the mother supposed to do? She does everything for him. And the father says, oh, my guy is a loser. I don't want to deal with him.
Right.
What is she going to do? She can't kick him out.
Yeah.
So this pathological avoidance disorder goes on for a long time. And if it is in Japan, it would be called hakikimori.
Oh, okay.
You've heard of it?
No, not the Japanese term. No.
This condition is very well known in Japan.
Oh, interesting.
He's sitting in the basement for the next 27 years. And he's either watching TV or just staying in that room. The father says the guy is a loser, never earned $1 in his life.
Yeah.
The mother says, what can I do? I have to give him dinner. And recently I read, because are you aware that in Japan, until 30 years ago, there was universal retirement plan? Everybody got pension.
Mm-hmm.
After the 1987 stock market debacle, subsequently, the Japanese market also fell. It did not recover like the American markets. So 10, 15, 20 years later, the Japanese economy could no longer sustain universal retirement. So there is less and less of that. So here is a guy, Hakikimori, who's been sitting in the basement. He's now 52 years old or 49 years old. His father recently died.
Uh-huh.
So what will happen to this guy? He'll be dead in 6 months.
Wow.
So if you go to the internet and put in the words hakikimore, he'll blow you away.
Wow.
So we have so many individuals who may have had adequate intellect.
Right.
In 3rd grade, 4th grade, 5th grade, they had enough mathematical skills. Somewhere around 10th grade, 11th grade, they dropped out. And some of them also have other mental health disorders, all the way to Adam Lanza.
Right. Right. From Sandy Hook.
Who should be diagnosing those? We are not adequately going after the 14, 15, 16-year-old who doesn't want to come to school, avoids everything, doesn't have friends, doesn't socialize, stays home, never went to the middle school dance, and does not want to walk for graduation. So, but the parent education is key.
Yeah, and that preventive education for the schools. I mean, the other end is profiling, but then there's kids that fit. They're socially isolated and so forth, and they need a friend, and they're just going by until I don't know. It's just it just somehow the school systems are failing to be aware of what you're talking about.
What about the parent system? The parents are obligated to learn about their boy. Why does he behave like that?
Yeah.
But the stigma of seeking help, saying that my boy has a labeled disorder,
Right.
that's what keeps you away from therapy.
Right. And finding a therapist that connects with your child. I mean, after a while of seeing therapists, the kid's given up. I don't want to see anybody. So I don't know. I guess there's about 10 minutes left to the hour, but I wanted to leave some time. I mean, you've been doing this a long time. You've helped thousands of people. And is there a message that you'd like to leave to, and the audience here could be parents, it could be professionals, could be teachers, therapists. Is there a message or more than one message that you would like to bring home to people?
I believe it is absolutely obligatory for parents to learn about the law. Individuals with Disabilities Education Act 1990 created what is called free and appropriate public education.
Right, which came from the PL 94-142 from 1975, the Education of All Handicapped Children Act. And I'm old enough to have taught that, yeah.
Out of that comes a need for parents to understand that my child has a disability. This is the name of this disability. Under this act, is entitled for free and appropriate public education. In order to make it appropriate, you need a diagnosis. Now, I am right now in Texas. Rob, you would be so surprised why the word dyslexia is so commonly used. I have a child with autism who has a subnormal IQ, and they just keep calling him dyslexic.
Hmm.
Parent doesn't quite understand dyslexic, and they're using Google for everything, but they don't look up dyslexia.
It sounds harmless.
Yeah, maybe. So,
It's not as bad as what retarded was.
yeah. So where I was going with the answer to your question is, we must teach parents under the law, your child is entitled to an IEP. IEP stands for Individualized Education Plan. To individualize that education, he must have a disability classification. That disability may be mental retardation, autism, learning disability, which learning disability, attention deficit disorder, or a physical impairment, or is it a hearing issue or a vision issue? So, under the law, your IEP must identify the disability, and a corrective action plan should refer to that disability and then a 1 year goal. But you have no idea. I have lived the last 25 years of my life with the disability classification on the IEP saying speech and language impairment. Really?
For who?
For, for the child,
For the
who
child. Okay.
he has autism,
Okay.
he has mild intellectual disability,
Right.
and they're carrying him as speech and language impairment.
Wow. Wow.
What do I need a professional to say my child is speech and language impaired? He can't talk.
Right. Exactly.
What? Speech and language impairment is not a disorder of the gastrointestinal tract, it's a brain problem.
Yeah.
So, my problem is the parents, whatever are the reasons in their life, have not adequately learned or educated themselves. More recently, I'm seeing pediatricians are
Hmm.
not spending enough minutes with the child.
Huh.
They see 3 or 4 children per hour. There are 3 or 4 medical assistants in 6 rooms. They do weight, height, BMI. Everybody is consumed with this BMI business, but they don't ask about report card.
Mm-hmm. Uh-huh.
Ask you to bring the report card.
Right. Body mass index. It's a number. And what really is important is what's going on in school.
Right. So until we change that culture, it would be difficult to educate the parent under the education law. This child, your child who has this disability, should have this kind of remedial education.
Hmm.
So I'm very fond of telling people, if you have a handicapped child and you don't have a lot of money, go to New York City. New York City Department of Education has the best services for special education. But don't go blind, you have to learn. You have to learn how to get a diagnosis, how to appeal to revise the IEP, to ask for a meeting, and then make sure the child is getting the appropriate education for his disability.
Well, that's interesting to hear that New York City has the best accommodation, the public schools,
Public school.
the best accommodation for special education.
It does not say great things about New York City. It says terrible things about the part of Texas where I am.
Hmm. Well, I guess that it's a lot about politics, I guess, no? Is
No,
it? Huh?
politics is an honorable word. It goes back to Julius Caesar. I don't use politics loosely. This is all education.
Hmm.
So you and I have the responsibility to educate the parent whose 6 year old is struggling in class and behaving badly. We have to educate her to get a diagnosis.
Well, historically, the way special ed started was with, mental retardation. I mean, besides physically handicapped, there are people who are blind, right, throughout history. But as far as like the special education is concerned, it came from parents. Parents
Correct.
were one who gathered together and they said, hey, my kid doesn't belong in a mental illness in a hospital. he should be, at that time, was called educable. And they changed they changed the system to education rather than mental illness. And it was the parents who did it. So the parents had the power. And what you're saying, let's bring the parents back with the power that they really have.
You are so right. About 35 years ago, there was a very celebrated case in New York State called the Rios case.
Mm-hmm.
The Rios successfully sued the state and single-handedly created the New York State Early Intervention Program that brought tremendous amount of money for speech therapy, occupational therapy, physical therapy. But there's one fallacy. Nobody asked for diagnosis. So they've been giving speech therapy for children who will never benefit from speech therapy. So they should have asked for diagnosis.
Yeah.
So if it is a child with cerebral palsy, legs are tight, he cannot walk, yes, of course, spend money on physical therapy and occupational therapy.
Right.
If a child has only speech disorder, yes, get him speech therapy. But my kid has no speech, and he sleeps 2 hours at night, and he survives entirely on chicken nuggets. That's no speech disorder.
Right.
So the problem is,
Yeah.
many times the pediatric clinics do not ask about what's the diagnosis. The mother goes there and they sign off another 6 months of speech therapy, occupational therapy.
Oh, it's a shame, and you made that point before. There's speech, but then there's communication,
Correct.
and language, and you could have no speech at all and communicate fine.
That's why I drill down the word deaf mute.
Right. That's right. Excellent. Well, I thank you, and I think so many people are going to really appreciate this, your words, your talk. You're available to, I don't know. I mean, you're busy. I'm not going to, but I think this is really a real pleasure, and I think people are going to be thrilled and honored to have you have your words of wisdom.
I might ask you to put up the name. My website still has a few videos of actual parent education classes, a lot of information, verifiable information on autism, especially treatments, which treatments do not work. So the website is called autismtruth.org. And you're also saying this is being recorded?
Yes.
Can you send it back to me? Because I actually want to update one of my lectures.
Okay, I'll need permission from Autism Today, but
No, I'm not going to use it on my website. As I play it back, I'm going to take some notes for myself to dictate another. See, right now I'm not recording it.
right.
I recently bought one of those holders where I put the cell phone. It has a light behind it. The light shines on my face, and I want to talk into it.
Right.
And that is my lecture on autism, and it's all entirely my properties, my words.
Right.
I put it on my website. I'm just saying, send me back what you have.
Right. Well, I take that as a compliment, and that if the information that you're giving and the exchange is something valuable for yourself, then I think people should pay extra attention to what you've said. And autismtruth.org. I looked at it before coming on with you, and it's a terrific, really informative site.
But the problem is, my site is old. I want to update some information. For example, my site says autism occurs in 1 in 150 children. The CDC says now is 136. Like that, I have to update some material.
Right. Well, I'm going to stop the recording now, and then we can talk about these details.
I have to run away anyway.
Thank you so much.